Cindy had mentioned, initially we were going to discuss just blood pressure, but not too long ago I was here and we did a presentation on hypertension. So I decided to go a little more in depth, or a general overview of heart health, okay? But before we go into that, I just wanted to remind everybody that the ideal blood pressure reading is 120/80. The systolic number, which is the top number on that reading, is the pressure your heart exerts while beating, whereas the diastolic is the bottom number, and that's the pressure as your heart's at rest. So if you have high blood pressure, such as 130/90, that's moderate high blood pressure. It's not too severe. But say you were at 120/95 or 100. That is a more riskier type of blood pressure reading to have, because while your heart is at rest, there's a lot of pressure on that bottom number. So if your heart's working, say doing cardio or something, of course the higher number, or the top number, would be higher. But while you're at rest, if that bottom number is high, that's a big risk factor. So blood pressure is known as the silent killer. There's generally no side effects or symptoms to blood pressure unless it gets to a very, like a life-threatening high level. And those symptoms would be vision problems, chest pains, difficulty breathing, confusion, headaches. That's when you would be at a severe point of high blood pressure. But in general, your blood pressure could be 130/90, 140/38, and you won't feel it. You won't know that your blood pressure is high. So a lot of times people go without treating their blood pressure because they don't know that they have high blood pressure. So it's always important to stay in contact with your doctor, make sure that you do your routine visits, and monitor your blood pressure yourself if you think you may have risk factors for that. So we'll go ahead and get started. So today's presentation is going to cover 10 tips for heart health. So of course, if you're taking care of your heart overall, that's going to also take care of your blood pressure. So that's why we decided to do an overview of general heart health and not just focus on blood pressure alone. So of course, exercising. That's one of the best things you can do for your overall health, not just your blood pressure or heart. The heart disease is the #1 killer for women, and 1 in 3 adults have high blood pressure. So exercising regularly, maintaining a healthy weight, those are all ways that we can help with our blood pressure. So brisk walking, yoga, running, aerobics, swimming, and active days. So active days can be doing yard work, cleaning around the house. I mentioned with the first group, like every Sunday, I deep clean my house, and I'm, scrubbing things, I'm cleaning floorboards, I'm sweating, the house, like I'm putting in work. So that is also exercise there. Just moving your body, staying active. So aerobic exercise is one of the best ways to maintain a healthy heart. Aerobic exercise improves circulation, which results in lowered blood pressure and heart rate. In addition, it increases your overall aerobic fitness as measured by a treadmill test, and it helps your cardiac output, which is how well your heart pumps. Aerobic exercise also reduces the risk of type 2 diabetes, and if you already have diabetes, it will help you control your blood sugar. So ideally, you would want to do 30 minutes a day, at least 5 days a week, of aerobic type exercises, which would include brisk walking, running, swimming, cycling, any type of cardio activity where your heart is consistently beating at a higher rate for a period of time, which they recommend 30 minutes. Resistance training. So resistance training has a more specific effect on body composition. So if you carry a lot of body fat, specifically in your core, which is the most dangerous place to carry excess weight, we're all built differently, we all have different body types, but if you happen to be somebody who is overweight, but specifically in their core, you are more at risk for certain diseases and complications. Reason being is because that fat surrounds your organs. So if your organs have to work harder to to function properly because of that fat kind of holding it back from working as it should, you are more at risk for problems. So resistance training can help reduce fat and create leaner muscle mass. Research shows that a combination of aerobic exercise and resistance work may help raise the good cholesterol, which is your HDL, and lower the bad cholesterol, which is the LDL. So have you guys ever heard of HIIT training? Anybody? I know you have. I see you're nodding, I see your arms. You know what HIIT training is. So that is high interval intense training. Is that what
high intensity interval training?
Interval training. So what that is where you incorporate doing weights with cardio. So you're weight training, but you're getting your heart rate up. And that's one of of the best exercises you can do for your heart. It is difficult unless you kind of work your way up to that, but that is the best thing you can do, is incorporate cardio with weight training. So how much or how often? So at least two non-consecutive days per week of resistance training is a good rule of thumb. The reason being is you want to give your muscles time to recover, so you don't want to go do like weight training 2 days in a row. Maybe do weight training and then cardio the next day, then weight training again, and just kind of go back and forth between the two, unless you're able to incorporate them both into your exercises. So examples of resistance training would be working out with free weights, such as hand weights, dumbbells, or barbells, on weight machines with resistance bands, or through body resistance exercises such as push-ups, squats, or chin-ups. And also stretching, flexibility, and balance. So flexibility workouts such as stretching don't directly contribute to heart health, but what they do benefit is your musculoskeletal health, which enables you to stay flexible and free from joint pain, cramping, and other muscular issues. That allows you to do those other exercises better or more efficiently. So if you're able to stretch that out, sorry about that. So if you're able to stretch, keep your muscles, your joints flexible, or your muscles flexible, your body will be able to perform better. So if you're able to stretch and stay flexible and balanced, you'll be able to work more efficiently while you do exercise. So if you have a good musculoskeletal foundation, that enables you to do the exercises that help your heart. So that's the way that ties in. Flexibility and balance exercises help maintain stability and prevent falls, which can cause injuries that limit other kinds of exercise. So how much or how often? We want to stretch every day. And I mentioned earlier that when I wake up in the morning, I'm not a morning person, so when I wake up after my alarm goes off, I usually lay in bed for like a good 10 minutes, 15 minutes before I can actually like push myself to get out of bed. But the first thing you do is stretch. Like, you know, when you wake up and you're like, oh, okay, I gotta start the day, and you kind of stretch out your back. That feels so good. It kind of wakes you up. So if you can like take it a step further and maybe get out of bed and bend over, touch your toes, stretch out your arms, and just kind of really prepare yourself for the day. You want to make sure you do that daily, and of course before and after any type of exercise that you do, whether it's running or weight training. So examples, so your doctor can recommend basic stretches you can do at home, or you can find like DVDs, YouTube. I like to watch videos on YouTube, that's probably the easiest way for me. That way you can see what exercises, stretches to do, and how, or what muscle they benefit. The next thing for a healthy heart would be to quit smoking. We all know smoking is bad. We all know that it can lead to cancer, but it also takes a toll on the rest of your body. So not just your lungs, not just your esophagus. So this is how smoking hurts your heart and your blood vessels. According to the Centers for Disease Control and Prevention, smoking harms nearly every organ in your body. Cigarettes have chemicals and other substances that can hurt your heart and blood vessels in many ways, including taking some of the good cholesterol away from your blood. So of course we want to avoid that. We want the bad stuff out, but we want to keep the good cholesterol in our blood. Temporarily raising your blood pressure. So cigarettes contain nicotine and caffeine are in a similar drug class. They are both stimulants. So when you drink a soda or an energy drink, you get that boost, you feel more awake, more lively. That raises your blood pressure, of course, you want to avoid those too. But when you smoke a cigarette, it has that same effect. You smoke a cigarette, it usually increases your blood pressure for about 20 minutes after you smoke that cigarette. So if you're somebody who's like a chain smoker, or who smokes throughout the day, multiple times a day on your breaks, you're going to have that consistent high blood pressure because you're frequently smoking and taking in that stimulant. Making your blood more likely to clot, which raises your risk for stroke, so we want to avoid that, of course. And lowering your ability to exercise. So I don't know if anybody in here smokes or has smoked previously, but when you're a smoker, you usually develop that smoker cough. You guys know what I'm talking about? Where they start to just kind of hack up phlegm, or they have trouble breathing. If you're going to try and do exercises such as cardio, if you want to go for a run and you're a smoker, good luck, because that is a struggle. Your chest will feel tight, your throat will feel tight, and it makes it more difficult to actually do these exercises. So of course, staying at a healthy weight and keeping your blood pressure and cholesterol levels healthy, you would have to quit smoking in order to achieve that. This is how quitting smoking helps your heart. The American Heart Association reports that quitting smoking helps your body within minutes. As time goes on, the benefits only get better. So after your first cigarette, or after a cigarette, 20 minutes later, your heart and blood pressure will lower itself. It regulates. So if I smoke a cigarette right now, my heart rate will increase, but in about 20 minutes it should level itself out. 12 hours later, the amount of carbon monoxide in your blood drops to normal. 2 weeks to 3 months later, your blood flow gets better, and 1 year later, your risk for heart disease is half of that of someone who still smokes. So you can lower your risk for heart and vascular disease by quitting smoking, and it's never too late to do that. There's a lot of tools out there to help people quit. So if anybody does smoke in this room, we offer a free smoking cessation program at Rite, where the pharmacist will help you gauge what type of nicotine replacement you would need, and kind of help you through that process. And they offer discounts on those nicotine replacement products and try to help you reach your goal. And drinking in moderation. So this is also really important. We all hear that, drinking a glass of wine every day is good for your heart, right? In moderation. And the glass is not filled to the top. That is not considered to be a glass. When they're referencing a glass, they mean just a couple ounces. That's a glass of wine. So we don't want to overdo it. So how does drinking affect your health and your heart? So regular or high alcohol use can hurt your heart and lead to diseases of the heart muscle called cardiomyopathy. Drinking alcohol regularly also can raise your blood pressure, which is one of the most important risk factors for having a heart attack or stroke. So like I had mentioned, if you're drinking in moderation, there are some effects, and specifically red wine, there are some effects that can help or benefit your heart, because alcohol is a blood thinner. So it will help the blood flow through your body a little more, it'll let it flow well. But if you're drinking too much, then it's going to increase your blood pressure, which can cause problems for you. Heavy drinking weakens the heart muscle as well, which means the heart can't pump blood as efficiently. So that's really important to remember too. So our heart is an organ, but it's different from all the other organs in our body because it's a muscle. So we want to make sure that we maintain that muscle. Drinking alcohol in moderation equates to 1 to 2 alcoholic drinks per day for men and 1 for women. So we get just a little bit on there, but men can enjoy 2 glasses of wine a day. Women, we can do 1, and that would be considered to be in moderation. And to reduce saturated fats from diet. So this is really important as well. The American Heart Association recommends limiting saturated fats, which are found in foods such as like butter, cheese, red meats, and other animal-based products. Decades of sound science has proven it can raise your bad cholesterol and put you at higher risk for heart disease. So what would be considered a healthy amount of saturated fats in your diet? So if you're on a 2,000 calorie a day diet, up to 13 grams. So it's between 11 to 13 grams of saturated fat in your diet. So that's what they would like for us to try to gauge. So you want to make sure that you kind of keep track of that. These are foods that we can eat that are good for us. So eat this versus that. So fats. We do need healthy fats in our diet. So olive oil, canola oil, vegetable and nut oils, margarine, trans fat free, cholesterol lowering margarine such as Smart Balance, that's the brand of a specific kind, nuts, seeds, and avocados, lard, butter, bacon fat, gravy, cream sauce, non-dairy creamers, hydrogenated margarine, and shortening. I had a hard time saying that earlier this morning. That is quite a mouthful. Cocoa butter found in chocolate, coconut palms, cottonseed, and palm kernel oil. So we want to avoid those. Have any of you guys heard of the keto diet? That's pretty popular right now. That is everywhere. So essentially what the keto diet is, you eat less than 20 carbs per day, and your body's gonna, and high fat. You want to consume a lot of fat because that triggers your body to go from burning carbs for energy to burning fat for energy. The thing about keto is a lot of people are not educated on what's a healthy fat versus what's not healthy. So a lot of people who do keto are putting butter in their coffee. They're putting butter with their bacon and eating it together as a meal. And yeah, that is high fat, and you will see weight loss because your body will burn the fat, but at the expense of your heart, the expense of your cholesterol. So just being educated on what type of fats are good to consume, what's healthy, that's really important to having a well-balanced diet and to make sure that you're treating your heart well. So as far as grains go, so whole wheat flour, whole grain bread, preferably 100% whole wheat bread or whole grain bread, high fiber cereal with 5 grams or more of fiber in a serving, whole grains such as brown rice, barley, and buckwheat, whole grain pasta or oatmeal, steel cut or regular. And it's always best to get the steel cut or regular, because if you're buying the ones that come in the packet that are like the cinnamon and brown sugar or something like that, that has a lot of sodium, a lot of sugar, so you want to avoid those. Generally speaking, we want to avoid food that comes prepackaged, stuff in a box, stuff that comes frozen. Those are all processed. They have things that are added into them, preservatives, and those are not necessarily that healthy for us. So if you can eat more of a natural diet, things that you would have to go home and cook, little more, little less convenient, but at least you're treating your body well. So the grains that we would want to avoid are white refined flour, white breads, muffins, frozen waffles, cornbread, donuts, biscuits, like all the good stuff basically, all the good carbs, or the yummy carbs we want to avoid. Cakes, pies, egg noodles, buttered popcorn, high-fat snap crackers. So we want to avoid those types of foods. And even if you just make a couple changes in your diet, such as switching out white rice for brown rice, every little bit helps, okay? And then as far as proteins go, so low-fat dairy products such as skim or low-fat milk, yogurt and cheese, eggs, fish, especially fatty cold water fish such as salmon. Salmon is really good for us. It has a lot of fat in it, but it's the good fat, the kind that we want, the kind that will help our cholesterol. Skinless poultry, legumes, soybeans, and soy products such as soy burgers and tofu, lean ground meats. And so we would want to avoid full-fat milk and other dairy products, organ meats such as liver, fatty and marbled meats, spare ribs, hot dogs and sausages. We had a little discussion earlier this morning about like hot dogs. I don't know if any of you guys have seen how hot dogs are made, but you can look that up on YouTube. I don't know if you want to. But it's pretty traumatizing. It's all the random pieces of animal ground up and put into a sausage, and you know, that's our all-American food there, hamburgers and hot dogs, but they are not healthy for us. We want to avoid those. Bacon and fried or breaded meats. So if you're going to eat chicken breast, make sure that it's skinless. Try not to fry it, cook it. Usually I bought a stick-resistant pan so that I can avoid putting oils and all that good stuff, well, bad stuff, on my meats, so then I don't have to use that. So just making these little changes can help. And to add more fruits and vegetables. So fresh or frozen vegetables and fruits are good. Low sodium canned vegetables, canned fruit packed in juice or water. So juice and water is okay if you're going to buy like the canned peaches or fruit cocktail. If it's in the syrup, that is not making a healthy change. You're adding something healthy to your diet. That sugar does have a lot, or I'm sorry, the syrup has a lot of sugar, so we want to avoid that. Fruits and vegetables to limit would be coconut, vegetables with creamy sauces, fried or breaded vegetables, canned fruit packed in heavy syrup, frozen fruit with sugar added, so we want to avoid those. My sister, she's trying to transition her diet to something healthier, and so we've kind of been partnering on that. And every time she'll send me pictures of her food, she's like making small changes. So she'll like start to eat more vegetables, but it's like tempura vegetables, and it's like it's breaded and it's deep fried. I'm like, okay, you're headed in the right direction, just a little bit more progress, but we just want to make sure that we make these healthy choices. And of course, it's not going to happen overnight, but making these lifestyle changes over time will benefit our overall health. So diet is an important risk factor in our overall health and wellness in general, not just related to our heart. Food-related risk factors include obesity, high blood pressure, uncontrolled diabetes, and a diet high in saturated fats. A low saturated fat, high fiber, high plant food diet can substantially reduce the risk of developing heart disease, high blood pressure, and diabetes. So we want to keep that in mind. So eating well not only protects our heart, but what we put into our body is what we get out of it, you know? So we want to take care of ourselves as best as we can while we can. This is also very, very important for our heart and for our general health. So mental health for heart health. This is something that we don't usually talk about, but anxiety and depression, those are real. That is something that exists, and it happens to a lot of us, if not all of us. If you have anxiety, if you have depression, you usually become worrisome. Sometimes you become closed off from people. Everyone reacts differently. But that can result in high blood pressure, which does take a toll on your heart. I personally, I get anxious, I'm overwhelmed sometimes. We get stressed out at work, whether it's work or at home, family, relationships, we all have, our own problems. We come to work, we clock in, we put in our 8 hours, and we go home, and, we leave those problems there. but they still exist. And you know, we can't always address these certain issues, but we can take care of our mental health as best as we can. And if you are able to do that, it will benefit your overall health as well. Another complication of depression or anxiety is also weakening your immune system. So if you're somebody who has either of those problems, your immune system lowers by up to 30% usually, if it goes untreated. So heart conditions such as heart attack and angina, which is chest pain, are also known as cardiovascular disease. These conditions often occur with anxiety or depression. In fact, we know now that depression is a considerable risk factor for coronary heart disease, along with smoking, high cholesterol, and high blood pressure. So untreated depression or anxiety is just as bad for you or harmful for your heart as smoking. So that's something that we really need to identify in our personal lives and try to manage your stress. Take time for yourself, keep a journal, different things that we can do. Meditate, yoga, which will also be a physical activity. But maintaining your mental health will also benefit your immune system and your heart. And my favorite is sleep for heart and overall health. So I personally do not sleep the recommended 7 to 8 hours a night. I work 2 full-time jobs and I go to school, so if I get 5 hours a night, it's a good night. That is a great night for me. But that's not healthy. That's not good. I don't recommend that. Adults who sleep less than 7 hours each night are more likely to say they've had health problems, including heart attack, asthma, and depression. Some of these health problems raise the risk for heart disease, heart attack, and stroke. And these health problems include high blood pressure. So that's really important. So when we sleep, it gives our body time to kind of regenerate, to rest. Our breathing level reduces, our heart rate reduces because our body is taking it easy, it's resting. So if you're not sleeping for that 7 to 8 hours, you're not giving your body time to really recover from what it endured throughout the day. So during normal sleep, your blood pressure goes down. Having sleep problems means your blood pressure stays higher for a longer amount of time. High blood pressure is one of the leading risks for heart disease and stroke. About 75 million Americans, so 1 in 3 adults, have high blood pressure. And up to 30% of those people don't even know it. Keep that in mind as well. That's why I mentioned earlier, it's really important to make sure that you are checking your blood pressure, or at least making sure to go to the doctor for your annual physicals and things like that, just to see if there's anything going on with your body. Type 2 diabetes. So diabetes is a disease that causes sugar to build up in your blood. We're all familiar with that. I was here not too long ago and presenting on it. But diabetes does cause damage to your blood vessels. That's why some people end up having neuropathy, that nerve pain, or tingling, or sometimes amputation. Those are all problems from diabetes that because it affects the nerves, the blood vessels, and then our nerves. Obesity. So lack of sleep can lead to unhealthy weight gain. So in the morning, if you had a rough night the night before, you only slept for like 5 hours, then you're like, okay, I gotta go to work, suck it up. You usually snack more throughout the day because your body is tired and you need energy. So you're more likely to snack on candy, to eat the donut in the break room, maybe to drink an energy drink, which those of course are not good for our heart. We want to make sure that when we're at work, when we're out, that we kind of monitor what we're eating. But when we have a lack of sleep, you kind of lose control over that. You'll snack more. This is especially true for children and adolescents who need more sleep than adults. So not getting enough sleep may affect the part of the brain that controls hunger as well. So you're kind of like on autopilot. I know there are days where I don't sleep as much as I should, and then I go to work, and while I'm at work, I can do my job basically in my sleep, and I'm just doing it without really thinking. And the same thing will go where there'll be chips next to you and you're snacking without even thinking about it, and you don't feel full because your body needs that energy. So this is how obesity affects your heart. So obesity requires a higher blood volume. So if you're a larger person, such as myself, I'm 5'8" and I'm a little chunky, so I have a higher blood volume than most people. Well, somebody within a normal weight range, which means that my heart has to work harder to pump that blood throughout my body. So over time, that can result to heart failure. So it's just like an old car. If you're going to run that car into the ground and you're going to put a lot, work it hard, it's going to break down eventually. So it's the same thing with your heart. If you are working it hard and you're not treating it well, it's going to break down, and it can result to heart failure. So this is also really important. So adherence to medication regimens. So generally speaking, not just for heart health, but if you are on any type of medication, whether it's for cholesterol, blood pressure, diabetes, thyroid, anything like that, your medications only work if you take them. So that's really important, and if you take them as directed. So a lot of times I'll have patients who will have gaps in between refills, and when I contact them to say, hey, you haven't picked this up in a month, what's going on, are you okay, have you experienced any side effects? They'll tell me like, oh no, I take it every day, I'm good. I'm like, well, you should have refilled it last month. And they're like, I'll ask them, well, how do you take your medication? And a lot of times they'll say, oh, I take it every morning with my vitamins or with my other medications. And I'll ask them, well, did you realize the bottle says to take it 3 times a day? So it's not just taking it once a day or trying to make a good faith effort in taking it. You have to be on track and taking your medication as directed every day. So adhering to your medication regimen can help control blood pressure, reverse high cholesterol, and manage diabetes, all conditions that affect your heart and overall health. So that's important. Your doctor prescribed it to you because you need it, and it needs to be a part of your daily regimen to take your medications as directed. That's the key thing, as directed. So here, just a quick overview. So the best way to take care of your heart is to exercise, maintain a healthy weight. Lifestyle changes or medication may reduce high blood pressure, so remember, make sure we take our medications as directed. Make lifestyle changes if need be for smoking and for alcohol consumption. And make a couple swaps in your diet, whether it be from switching from whole or from white grain, like white rice to brown rice, to deep frying your food, to grilling it. Just making those small changes can make a big impact on your overall health, your weight, and your heart. And that's all I have for you guys today. Thank you for coming.